Welcome to Revolutionary Health Live, the show that focuses on Black gay men's health and wellness. I'm your host, Michael Ward. So excited to be with you all tonight to talk about this very important topic, the COVID-19 vaccine. We've got a wealth of information to present to everyone, so make sure that you remember we're live. So ask as many questions as you'd like so we can make sure that we include everyone. And make sure that you follow us on our social media everywhere, CNP Tribe. We want to make sure that you stay updated on everything that's going on in our world, especially the Reckoning magazine. But I'm so excited that I have two guests that I love talking to very much. Dr. David Malebranche is back here on the show. We love to see his face. As well, I've got Jerron Totten here from LGBT Detroit joining us again to the show. I'm so very excited, you guys, to be able to bring this information to everyone about the vaccine. But before we get into all of that, just want to start with asking you both, how are you? How's everything going on in your world, where you are? You can kick it off, David. Since your birthday was last Saturday, y'all tell them happy birthday.
Right. So, hey, everybody. David Malebranche, happy to be here. I'm actually repping Benny Etienne. I have a name. Benny was on Project Runway a few years back and has done some amazing stuff and has an amazing line of clothing. He's a brilliant fashion designer, and I believe based in Dallas, but he's also Haitian, so I wanted to rep him today. I'm feeling pretty good. It was 72 degrees in Atlanta today. I went for like a 7-mile walk earlier. So I just had a good time. And I'm just happy to be here.
I'm doing well as well. Just glad to be here. Thanks. Shout out to CNP for having me again. It's still cold in Detroit, so we'll probably be seeing some warmer weather in a few weeks. I'm sporting my alma mater, North Carolina A&T. We are the #1 public HBCU in the nation. Aggie Pride is worldwide.
Come on, I'm loving this history. Everybody got their shirts on. But I definitely want to dive into this since I know we're going to get a lot of questions and a lot of information to cover, especially with COVID-19. We've surpassed 500,000 deaths here in America, which to me is just astronomical. But I just want to start both by talking about the experience of taking the vaccine and what was that decision like as well, of saying that, I want to go ahead and get vaccinated. Because I remember specifically a conversation that I had a few months back on Revolutionary Health with you, Dr. Malebranche, where I was like, I ain't giving my body to science. I'm not going to donate it. I'm not going to let them experiment on me and all of these kind of things that I was going through. So just walk me through that decision of deciding that, the vaccine was for you, and what was the experience like?
Well, I mean, for me, I wasn't going to do it at first. I was going to wait until actually, things became, it was open to the general population, which would probably be in later March or April. But then I took a part-time job working at the AIDS Healthcare Foundation clinic at AIDS Atlanta. And I started working there about 2 weeks ago. So when we were having those conversations about a month ago, I was like, I'm going to start seeing patients again. And I hadn't been seeing patients in the clinic since September of 2019. So I kind of knew at that point that I wanted to get the vaccine. At first, I tried to get into a trial, like a vaccine trial, a clinical trial, and that didn't work. And then I ended up getting a colleague of mine who works at Emory and said, well, you can go to Grady. Here's the link. She gave me the link and she said, it's very true. I've worked at Grady Hospital probably for 17 of the last 20 years in some way, shape, or form. So I was able to set up an appointment there and got the vaccination, and had the first one over a month ago, and then had the second one, not this past Tuesday, but the Tuesday prior. And the experience was fine. I was in and out in a few minutes. Only had some soreness in my arm where they gave me the shot. I was kind of proactive in that I took ibuprofen and Aleve after I got the vaccine. So I had a meal afterwards, and I took some, anti-inflammatories. And I didn't have, even with the second one, I didn't have kind of a big, feverish. I didn't feel knocked out, anything like that. So to me, it went pretty smoothly.
Do you want me to answer the same question?
Yeah, definitely.
Okay. Well, I I recognize several things when the opportunity for vaccination, first came on the scene. It was a study that I was going to try to get into, because I realized several things. Like, I catch everything that blows. And so while I was shocked that at that point, by the time a vaccination trial came out, we were already about 5, 6 months into the pandemic. And I was already shocked that I did not catch COVID. Right. And so I missed the appointment for the trial. And so I didn't get on the trial. I then heard that the city was giving out vaccines. And so I got a vaccine from the city. The first shot was fine, little arm tenderness. But the second shot, I did have some issues with, not issues, but like I felt the side effects after the second shot. I had a fever. My fever probably went up to about 103. And the body aches set in, but it was gone after 24 hours. I think the fever broke. I just got my second one Thursday. And so Friday, my partner stayed home with me because he saw the fever. But by Saturday, like Friday evening, early Saturday morning, the fever broke, the body aches went away. So yeah.
Thank y'all both for sharing that experience with me. And just to remind everyone watching as well, Jerron is in Detroit. We've got Dr. Malebranche in Atlanta. So we've got two different sections of America with the vaccine. Of you all like to end the chat, we are live, so we want to make sure we get as many in as we possibly can. But I did have a question from earlier from my Instagram, Dr. Malebranche. People were asking, why do you need 2 shots for the vaccine?
Yeah, I mean, it depends on the vaccine itself, right? So, hepatitis B has been traditionally 3 shots. Hepatitis A is 2 shots. Flu is 1. It just depends on the type of the vaccine, how it's worked, and how it's composed. I think with both the Pfizer, biotech, and the Moderna ones, they were operating by a completely different technology, which was that mRNA vaccine, which is like a synthetic. It's not dead vaccine. It's not live vaccine. Or not live virus. It's none of that. It's not giving you any dead or live viruses. It's actually synthetic. So it's tricking your body into thinking a component of the coronavirus is there in your body, and then your immune system attacks it. The reason why you need a second one is that sometimes the first shot just kind of introduces your immune system to it. It ramps up and produces antibodies or proteins to fight it. And then by the second one, then it really ramps it up even more the second time you get exposed to something. It kind of primes your immune system a little bit more, and that's where you get the 95% reduction in illness, hospitalizations, all that stuff of people getting severe sickness from COVID-19. So that's how it works. But it's similar. I think a lot of people nowadays are learning about the immune system a lot more, and the immune system is such a confusing system in the body. To be honest with you, I don't think a lot of medicine truly understands all of it. But it's similar to kind of the way you get exposed to something, say pollen. If you move to Atlanta, you get exposed to pollen the first time and you may have some mild symptoms. That's your immune system actually reacting against the pollen. But then that second year that you get re-exposed to it and your immune system is ready, all of a sudden your eyes are watery, you're like wiped out, you're fatigued, you're sniffling, you're coughing, scratchy throat, all that stuff. So sometimes the immune system needs a bit of a boost in order to build up that response. And I think that's partly what we're talking about, why those 2 vaccines need 2 shots apiece. And the Johnson & Johnson one that is probably going to be FDA emergency approved this weekend or early next week, that's only 1 shot.
Come on, 1 shot. With that, thank you very much for that explanation. After getting vaccinated as well, for you both that can answer this question, how do you feel? Do you feel safer? Do you feel any better than you did before taking the vaccine? I know Jerron said that you are at risk of still catching stuff, but how do you feel about it? I'm curious.
I feel a lot better, and that's really because from a child to now, I have caught colds, upper respiratory infections very easily. I feel like as a nation, we were kind of backed into a corner by the last administration to where we really did not and don't have a choice but to trust something at this point. We're either going to take a risk in getting COVID and dying, or taking the vaccine and having some kind of adverse side effect. And so I felt like I was in a better position to take my chances with the vaccine than without the vaccine.
Yeah, I would just say the same thing. I think, I was happy that I felt blessed to be able to get access to the vaccine. I similarly felt the same way that Jerron stated, that I think we were caught behind the 8 ball. We're still trying to catch up from some of the previous administration's mess ups with this. But I'm happy that I was able to get it. And I think the rollout, what's frustrating for a lot of people that I hear is that, they want to be able to get it, and they can't get it for whatever reason. And it really varies by states. I've heard of some people in some states being able to get it rather quickly, even though they're not healthcare workers, they're not essential workers, they're not over 65, but they're able to get the vaccine. Other states, other locales, people, there's just a long waiting list. And so it really depends on where you live. But I just keep telling people to keep trying to find out what's going on and stay on it, because, people are really wanting to get this. And this whole thing that, Black folks don't want to get this vaccine is a bunch of bullshit, because there are a lot of Black people lining up for this. And so I don't really believe the hype that they're all saying. I think there's some legitimate concerns about and questions about the vaccine. But I don't think any of that is kind of things that, folks can't handle or folks can't explain. And I think it's more of, from my experience, I've seen a lot of people, Jerron, you may want to speak on this, what you're seeing in Detroit, but down here in Atlanta, I see a lot of people just saying, well, I just want to wait and see. I want to wait and see what's going on, because a year was a little bit too quick for me. So I want to wait and see what's going to happen. And I don't think that's necessarily unreasonable. But for me, as a scientist, as a medical person, I've seen people die. I've seen tons of friends get sick from this. I've seen other people get hospitalized. And I'm just like, you know what? I'm not going to take that chance. I would much rather get the vaccine and have some mild side effects than take my chances of getting, the whole COVID-19 syndrome and then the risk being hospitalized.
Absolutely. I'm sorry, Jerron, were you about to say something?
Yeah, it really does vary by state. Here in Detroit, it's down to the cities. If you live in Detroit, you'll call the city of Detroit right now if you want to get a vaccine, or if you live in another suburb. But I'm looking on the Facebook Live. I'm seeing some questions. Is it okay? Someone said in North Carolina that they can't get one there. And it really, for North Carolina, because I'm from North Carolina, my grandmother still lives there. She's getting her second vaccine tomorrow. They are given by the county. So you'll want to reach out to your health department at your county. I think that was Art Jackson that made that comment. You want to reach out to the health department at your county to try and get a vaccine. For me, I'm going to be honest here. When I called to the city of Detroit to get my vaccine, they were looking for certain kinds of workers, and I wasn't sure until after I told the lady that I work at LGBT Detroit. She said, "Oh, you work at a gay shelter, a gay homeless shelter." Well, we're not a shelter, but we are an education advocacy organization. But I did not argue with her. Sure, I work at a shelter. Let me get my shot.
Exactly. Whatever it takes, right?
And so there were some other people in my office and some other friends who are kind of in the same work that I'm in. And sometimes it does depend on who answers the phone, because when they tried to call and say, "Oh, I work for an LGBT organization," some people were like, "They're not on the list." And so, it really just depends. That's why we really need a more uniform rollout across the nation, because some people are not able to get it just because they live in a certain place. And yeah.
Absolutely. And there were coming out in the past few weeks about certain counties here in Georgia that were giving people the vaccine that weren't in the certain groups that were reprimanded for that as well. But people want to take the vaccine. And I was going to say, to your point as well, Dr. Malebranche, when it comes to Black and brown communities of people taking the vaccine, I am one of those people where I was like, let me see what it does for y'all. And if y'all are okay, then I feel like I would be fine. Because like I say, I admittedly was very skeptical. I felt, especially a lot of the last administration's messaging and things about this vaccine coming out and things that just were not true. We'll just say that kind of made me skeptical. But even seeing the information that's coming out with Black people taking the vaccine that are absolutely fine, you know, it gives me a little bit of reassurance and courage to to go ahead and take the vaccine when it is available to myself. But there is this myth within Black and brown communities now, which is well-founded when it comes to medical trust and mistrust about vaccines. And I just want to speak a little bit about that, because I know in some of my conversations I'm hearing with people about the government putting things in the vaccine, putting things in our bodies, but there are people who still want to take this, and they need to see people like you and Jerron as well taking this vaccine. So what do you say to those people who are skeptical and may feel that the government is out again trying to get Black people, basically?
Yeah, I mean, I shut up and listen when people express that concern, because it's a very legitimate one, and it doesn't have as much to do with Tuskegee as it has to do with, like, they keep saying, well, we know about the history of racism, and they keep emphasizing the word history, and I was like, you're acting like present day racism in the medical field does not exist, which is a lie, because we all know that discrimination still happens, and we saw it play out last year with COVID, from Black people getting turned away from emergency rooms and being told to go home, and they were on death's doorstep, and then they died at home. And you weren't seeing that happening with a lot of white people. They were letting them in and getting them treated and this, that, and the other. So, you know, I listen first, and then I don't try to pressure people with it. One of the best analogies or stories that I heard from one of my good friends, her name is Kimberly Manning. She's a professor at Emory and works at Grady. Her handle on Twitter is @GradyDoctor, and she's absolutely amazing. And she did a stream of tweets with her stories, and it was a hashtag, what's your why? And it meant, what's your why, whether you're going to get the COVID-19 vaccine or not? And she was just stopping people on the street and just talking to people in random encounters and saying, hey, you're going to get the vaccine. This one woman was saying, well, I heard they're going to put something, you know, this mRNA vaccine is like it's a synthetic, it's nanobots, and they're putting that so they can track us. And she listened to the woman and just said, yeah, I've heard that rumor as well. I've heard people be concerned about that. And then she brought up the point. She said, well, don't you think with our cell phones, they already are tracking us? So they're tracking who we call, what we do online, what we do. And the woman had a cell phone. She said, so why would they go that extra step? Why would they have to create a vaccine to put something in our arms if they're already tracking us by our cell phones, which has much more information and can give them just as much detail about us? And the woman was like, yeah, I never thought about that, but you're absolutely right. And then she saw the woman again later, and, she wasn't a hard no on the vaccine, but she was just a little bit like, yeah, I'm going to wait and see. And then she said, Dr. Manning, I really appreciate you telling me that. And I appreciate you taking the time to talk to me. And it made a difference, because she said, I think I'm going to get the vaccine now. And so it really just takes having a conversation and listening. I think there are too many of us who are sitting there and judging people and saying, oh my God, don't you care about, our communities? Don't you care about public health? How can you actually say that? And they're screaming at people. And I'm like, yeah, folks, people have legitimate concerns. And this is not a normal thing that's happened. And this is not the normal speed with which a vaccine has been produced. And we had a very abnormal president for the past 4 years. None of that shit was normal. So you're going to have to excuse a lot of people if they have concerns.
Yeah, I agree. I'm not too much into believing that it has something that'll track us. But at the same time, I'm thinking to myself, we give up so much information willingly. Facebook, Twitter, Instagram, every single Google search that we have. We give up so much information willingly. Like, the last thing that we need to be thinking about as we try to save our own lives is whether or not they're tracking us with the vaccine. I just, I think Google has more information on me than my doctor's office.
And that's a fact.
History this past year with this pandemic. going on. And as well, I want to make sure that people check out your experience also on your Instagram. I'm not sure if it's on your Facebook, Dr. Malebranche, but your experience with taking the vaccine that you posted a video of as well for people to actually watch your experience.
Yeah, you could look me up on Instagram. It's at DMALEBR. Just, type in my first and last name, David Malebranche. You should be able to pull me up. But I put a couple videos just following up. The first one was about, and also talking about living with HIV and whether it was safe to get the vaccine or not. And I felt it was important to actually say that and tell people, because initially when we saw the COVID-19 studies coming out, they weren't finding that people with HIV were more susceptible to like more serious infection, hospitalizations, or death. But then as the end of 2020 came around, we started seeing some studies that were saying, hey, actually people living with HIV, even if they had, an intact immune system, were undetectable on meds, they could still be at higher risk. So they were kind of softly recommending that they bump living with HIV into more of a high risk category, or bumping them up into more of a high priority category with the states about who was going to be getting the vaccinations. But I know a lot of people were scared, and I got a lot of positive feedback. A lot of people were DMing me saying, like, thanks for that information. That was helpful, because, if you don't see someone actually dive in the pool to see how cold it is, you're not going to know. And then you see somebody be like, oh, this will be okay. So, I felt it was important to kind of share that with people on a general level, and then also specifically about living with HIV. So I'm recommending it to all my patients. I took it myself. The studies actually had smaller numbers. The Pfizer Biotech, the Moderna studies maybe had less than 200 participants who were living with HIV in each study, but they didn't find anything abnormal or any horrible side effects in any of those groups. So I feel pretty confident. Obviously, we need more studies. We need greater numbers. But I think right now, I think the benefits outweigh the risks for sure.
Absolutely. Also, a question before was, even with taking, is it important that you still wear your mask?
I can't speak to the scientific side of it, but I'm still committed to wearing my mask. I know that having had both vaccines, the chances of me getting, terminally ill or being hospitalized have decreased. But I'm just at a point where I don't want to get sick, period. And what I can say is that since we've all been wearing masks, I have not gotten sick. Like, I haven't gotten the cold, the upper respiratory infection. So the whole mask thing works. The last time I got sick was right before COVID happened. We had an event at work, and my boss was sick, but the event was so important. We had a presidential candidate sending surrogates to the office to have an event with the community. So we were all there. And that was the last time I got sick. I got that from him. That was February of 2020. I haven't had a cold since, when I normally get a cold maybe once a quarter or twice a quarter. I have not had a cold since. It's been a year.
Yeah, and I'll add on to that. I think from the scientific studies that we've seen, and I think it's a good reminder for people with the vaccine that these vaccines are 95% effective in reducing your risk of severe illness or disease, meaning you're really sick, you have to be hospitalized, the risk of death, those kind of things. It's not 95% less likely that you actually catch the SARS-CoV-2 virus that causes COVID-19. So the answer to your question, Michael, is a short one. It's, you can have the vaccine and be protected against getting severe symptoms, and yes, still get SARS-CoV-2. You feel fine, but then you could have it in your nasal passages and your droplets and pass it on to someone else who may not be vaccinated. So it is important. I'm fully prepared for the rest of this year to be wearing a mask for the most part, until we have about 75% or 80% of the country, what we consider the threshold for herd immunity, where most of the country has antibodies to it, that I feel safer running around. But to Jerron's point as well, last time I was sick was January of 2020. I caught what I thought was the flu, but you haven't heard much about the flu this year at all. And the reason is because people have been wearing masks. And so I think that's a good thing. So I think, even if you get the vaccine, feel safer that you won't get a severe form of the illness, but you still need to protect yourself because you can still catch the virus itself. And that's very similar to what the flu shot does. The flu shot, and just for comparison's sake, people don't know this, but the flu vaccine every year, its level of effectiveness in reducing your likelihood of getting really bad, getting the flu really bad, it varies from like 45 to like 60%, depending on the year. So like 95% for these COVID-19 vaccines is like astronomical. And so I think it's the same thing with the flu shot. So I think we just have to keep that in mind, that it's not preventing you from catching it, this COVID-19 vaccine. It's preventing you from really getting sick from it, which I think is a huge deal.
I wanted to respond to Carrie Steele on Facebook. I told you I'm looking at the feed over here. He said he lives here in Michigan, and he was looking online to see where they would be given. Right now, each city is handling in Michigan. The cities are handling vaccine distribution in Michigan. So, like, if you are trying to get a vaccine at the TCF, you have to show something with a Detroit address and your name, something. So, just remember that.
I'll add on to that here in Georgia, it is by county. So you want to check your county health department's website, the state's website, and go on from there. I will say a couple things. Shout out to Leo Moore, who does a great YouTube channel called The Practical MD. You should check him out. He had Stefan Wallace, who does a lot of work in HIV at the Fred Hutchinson Center and with the HIV Vaccine Trials Network. And they had a great episode talking about the study itself, the studies themselves, and kind of how the vaccine works. That's one thing. But also here in Georgia, there's a Dr. David Holland who works with Emory, but is also really spearheading a lot of the COVID-19 vaccine stuff at Fulton County. What he has always told me on Twitter recently is that the problem that they're seeing is always about supply. And so they have so much demand and they just don't have enough, which again, to Jerron's point, is that that's a problem for the federal government. The federal government previously said, oh, we got this vaccine, good for us. We did it at warp speed. And they didn't even plan on a rollout, on getting equitable distribution to all the states, about making sure there was enough vaccine available for the demand. They didn't do any of that. And so they just left that in the hands of the current administration, which is now trying to clean up that mess and move forward. And I think, thankfully, we're starting to take the steps, but you can see it kind of just slowly inching forward. But I know here in Georgia, you have to check your county's website and keep checking back, because I think they know. I don't know what it's like in some of the counties in Detroit and in Michigan, Jerron, but here, I guess they're getting it on a rolling weekly basis where they find out what kind of supply they're getting every week. And so they have to open up the online scheduling on a weekly basis. And then by the time people, of course, for that week, when people jump on and they flood the system and schedule all the appointments, it's done within probably a few hours or a day. And then you have to wait another week after that. So it really puts the pressure on individuals to be persistent and keep checking back again and again and again, which is crazy, but that's just where we are. And I'm hopeful that as the supply ramps up, we'll be able to, meet the demand.
I want to point out, I think another thing that's interesting is in Georgia, you can also get it at a like a Kroger, a CVS. That hasn't happened yet here in Michigan. And much like for those of you in North Carolina is also the same way, where they know week to week how many vaccines they have to give out. So if you call your city or county, however they're distributing the vaccine at the beginning of the week, early in the morning, you gotta be up at 8, 9 o'clock and calling at 8, 9 o'clock to try to get a chance at getting one of those slots. But the vaccine rollout in pharmacies hasn't happened here in Michigan yet, but I know that it has in Georgia.
Thank you definitely for that. We have time for one more question. I want to squeeze this in really quickly, but someone asked, how can people learn about COVID-19 studies and get involved?
The best site that has been for COVID-19 since it started actually is the CDC's website. And I would just say to go to cdc.gov, and they'll talk about the latest studies that have come out. That they have people in there. And, I just want to remind people that the previous iterations of the CDC with the previous administration was reflective of that administration. Dr. Rochelle Walensky is the head of the CDC right now. And already within like a month or two, she's been already very transparent, very vocal, active presence on Twitter, doing all that. So even last time, there were some questions about some things that were coming out. There was some conflicting stuff that was going on with the government. And it was always kind of shaky. But now I think everyone's on the same page, the scientists as well as the government. And you don't realize like what a blessing that is. And like you take it for granted. And then you saw what was happening, last year. And it was like, oh my God, like if these people aren't on the same page, if you have people that don't believe in science, and then the scientists can't really do anything and they can't really say anything, it's really problematic. So right now, the scientists and the government are on the same page. And so check the CDC's website. But again, like Jerron was saying as well, like check your state websites, check your county Department of Health websites and see how you can get involved. Because they will also give you information about some of the more recent, there's still clinical trials going on. So if you want to get involved, you can get involved in clinical trials too. So there are more vaccines being tested right now. So it's not too late.
I have a question for Dr. Malebranche, if I can. Do we have time?
Go for it.
What was last year like for you as a doctor, someone in the medical field? It is a science, right? What was it like for you, like seeing science be disregarded at the federal level and seeing remarks being made like injecting bleach and injecting light? Like how did that impact like did you have a lot of patients? Like, did you think of like some patients that I need to call because they will believe it? Like what was it like for you?
Well, no, I didn't. And last year was a difficult year for me for other reasons. My father had passed at the beginning of the year. So I was kind of out of the loop a little bit. But just to your question, like as a scientist, as a medical person, I found it very frustrating because I was longing to hear from the CDC daily. And the COVID-19 task force would always start with the president or the vice president. And they didn't know, you look at Vice President Pence, he was the one that botched up the whole thing in Indiana with the HIV outbreak. So I was like, why is he even speaking? And so the only person that I trusted in that group, to be honest with you, was Fauci. And it's interesting because I see a lot of things on Twitter nowadays about Fire Fauci. There was a hashtag for Fire Fauci the other day, and people are kind of coming for him, but they were like, well, he didn't know what he was doing at the beginning. And I was like, this was a new virus last year at this time. None of us knew what the hell was going on. But I think it was really frustrating for me because I found all of us, public health officials, medical personnel, we were on our heels and having to battle disinformation daily, one-on-one with patients, with our friends, with our families, and definitely on social media. I can't tell you the number of times people sent me videos from crazy people that would say they were doctors and were completely misinterpreting data, were completely misrepresenting information. And I had to keep saying, please stop sharing this with your circles, because this is the kind of garbage that we're having to fight all the day. But once it gets out there, once something goes viral, it's crazy. But as a scientist, it was really frustrating for me. And people were like looking at me like, oh, well, you're just going to say this and say that. And I was like, I'm just talking about the facts and the science. Like, this is, it's not a political agenda on my part. It's not a personal bias. If you look at numbers and just stay with that, it is. But it was pretty frustrating all last year seeing that battle go on.
Nice.
Yes, thank you. We want people to share this video since we are getting the information out with you both. And I wish we had much more time to get in this conversation because I feel like it's so much more good stuff. But they're telling me to wrap this thing on up. So I definitely appreciate everybody here for joining us on Revolutionary Health Live. Make sure that you follow Jerron and Dr. Malebranche on their social media, as well as CNP at CNP Tribe on all our socials. Again, please be safe, wash your hands, wear your mask, and share your experiences as well. If you've taken the vaccine, if you prepare to take the vaccine, if you have questions, drop them when this drops on YouTube. But as always, be good to yourself, and I will see you again.